So, yes, good morning, Jayashri. Good morning, Jayashri. So, welcome to the session on anatomy of large intestine. So, yeah, I will be discussing the anatomy of the large intestine in detail. So, before starting the session, just give me a thumbs up in the chat box that the audio and visuals are perfectly fine. The audio and visuals are perfectly fine so that I can start with the session. Yes, chill. So yes, I'm waiting for your reply, guys. So yeah, yes, Sethi Usman Bita, good morning. Zareen Anam says it's okay, all the video and yeah, visuals, it is like fine. I'm good, Usman. What about you? I hope everything is going good. Everything is fine at your end also. Defaulter, good morning. I'm fine, Bita. I'm fine. Chill. So let us start with the anatomy of the large intestine. Yeah, anatomy of the large intestine. Already I have discussed the parts of the large intestine yesterday. So yes, we have discussed about the cecum. Okay, we have discussed about the cecum, right? We have to discuss, we have to discuss today. Yes, we have to discuss today, Dr. Yeah, Triple A, good morning, beta. Good morning. We have to discuss today about the ascending colon. Okay, the ascending colon. Then you are very well aware we have this. So this is the right side beta and this is the left side. So you are very well aware since this is the right side, so it is also called as the right colic flexure of colon. It is called as the right colic flexure of colon. Yes, no need to worry yaar, sab theek hoga. So just get motivated and start studying without wasting time. Perry Sam, good morning beta. Good morning. So it is the right colic flexure beta और इसको hepatic flexure of colon भी बोलते हैं क्योंकि इसके ऊपर the liver is covered. Okay, liver की covering होती है. That's why it is also called as the hepatic flexure of colon. Hepatic flexure of colon. Then this part beta you already know that this is the transverse colon. This is the transverse colon, right? Then we have splenic flexure of colon. Okay, splenic flexure of colon. Yes, splenic flexure of colon. You already know that splenic flexure of colon, it is also called as the left colic flexure. It is on the left side, right? Left colic flexure. And remember, beta, why it is called splenic flexure? Because the part of the spleen covers this area. The part of the spleen covers this area. And even the tail of the pancreas, beta. Yes, Ahmad Abukar, very good, beta. It is the splenic flexure of colon. Then the colon is descending down, so it is referred to as, yeah, the descending colon. Okay, we have the descending colon, the descending colon. Yes, descending colon. Then we have the sigmoid colon, or it is also called as the pelvic colon. And then we have the rectum and the anal orifice, right? So that these are the parts of the large intestine. Already I have drawn a diagram yesterday. Already, yeah, most common watershed area. Very good, Dr. AAA. I will be coming to that point as well. One by one, we will be discussing each part in detail now. So starting with the ascending colon beta. So up, use your brains and guys tell me now from where it will start beta. दिस असेंडिंग कॉलम इसकी स्टार्टिंग कहां से होगी और इसकी एंडिंग कहां पर होगी वेयर इट विल स्टार्ट एंड वेयर इट विल एंड बेटा वेयर इट विल स्टार्ट एंड वेयर इट विल एंड आई वांट एवरीवन टू आंसर दिस क्वेश्चन यस ascending colon what is the site first of all you should remember okay firstly you should remember the site beta yes anyone yes Ahmed Abukar okay it's not exactly at the cecum beta मैंने बताया था ileocecal valve होता है okay ileocecal valve होता है from there it is like starting so remember beta the site it is the right lumbar region It is the right lumbar region. Okay, you already know we have like 9 regions. We have 9 regions of the abdominal cavity, and we have the, yeah, umbilicus, right lumbar, left lumbar, okay, right hypochondrium, okay, and below lumbar region, right iliac region is there, right iliac. So it is located in the right lumbar region. It is located in the right lumbar region. Again, second point that you have to remember, it is extending beta. It is extending from ileocecal valve. Exactly. It is the ileocecal valve, okay, to the right colic flexion. Okay, to the right colic flexion. Okay, it is starting at the ileocecal valve beta. Ileocecal valve यहाँ present होगा. So yes, from here till the right colic flexure of colon, this part it is called as the ascending colon. This part is called as the ascending colon beta, extending from the ileocecal valve to the right colic flexure. Yeah. Yes, very good, Dr. Triple A. Now remember beta, what is the size of the ascending colon? What is the size of the ascending colon? Remember, it is almost 6 inches, almost 6 inches, or I can say 15 centimeter long. Okay, it is almost 16 inches or 15 centimeter long. Coming on to the third point beta, the tinea coli. I've already discussed about the cardinal features yesterday's only. So remember, there are, yeah, 3 tinea coli which are present. One, it is anteriorly present, one anterior and two posterior. One anterior and two posterior. Coming on to the next point beta, we have the peritoneum. Yes, we have the peritoneum beta. So remember that this is covered from front and sides only. It is the peritoneum covers front and sides only. Okay, the peritoneum covers front and side only. Now coming on to the blood supply first. So I want everyone to answer the question. Blood supply of ascending colon. Blood supply already, like I will be discussing it. Okay, after I have explained each colon, but I have discussed this topic earlier also when I was discussing the blood supply of the gut. So you already know we have the left atrium. Okay, I always start my discussion from the left atrium beta. I always start my discussion from the left atrium, left ventricle, then we have arch of aorta, okay, we have from the left ventricle basically aorta is coming. So we have descending aorta नीचे की तरफ जा रहा है, so this is thoracic aorta. This is thoracic aorta, and this thoracic aorta below the level of diaphragm will be called as abdominal aorta. Will be below the level of diaphragm. It will be called as the abdominal aorta. And the abdominal aorta is giving 3 ventral branches. Out of one, it is the superior mesenteric artery. It is the superior mesenteric artery. Right? Yes, it is the superior mesenteric artery. You are already aware we have now from the superior mesenteric artery. From the superior mesenteric artery, for example, this is the ascending colon. Okay, this is the ascending colon. So remember beta, over here, if suppose this is the superior mesenteric artery, if this is the superior mesenteric artery, very good beta, it is the right colic artery. But yes, again, one point more is there that you have to like clear it off. From this superior mesenteric artery beta, you will have one branch, okay, yeah, that is called as the right colic artery. As rightly said by Dr. Triple A, it is the right colic artery beta. So this right colic artery, yeah, it will give It will divide into upper and lower branch. It will divide into upper and lower branch, and then it will give straight branches. These are called as arcuate branches. These are called as arcuate branches. Okay, तो इसको हम लोग क्या बोलते हैं? ये अपर ब्रांच हो गई राइट कोलिक आर्टरी की, अपर ब्रांच. Or we have lower branch of the right colic artery, lower branch of the right colic artery. Yes, so yeah, and these upper and lower branches are giving these small straight branches beta, and these small branches, okay, these are called as arcuate branches. These are called as arcuate branches. Okay, अगर देखो सिर्फ right colic artery straight जाएगी तो it will supply only a small part of area. So see how the nature has made it. It has like dividing into upper and lower branches, and again it is giving these straight branches so that each and every portion of the ascending colon can be supplied. Each and every portion can be supplied. So yes, the blood supply, it is beta. Yes, remember it is the right colic artery. Along with that, from the superior mesenteric artery. Okay, from the superior mesenteric artery, another branch is coming, and that is called as ileocolic artery. Okay, ileocolic artery, ileocolic artery. And remember beta, ileocolic is also dividing into ascending and descending branch. Ileocolic, it is also dividing into ascending and descending branch. So remember beta, the ascending branch, okay, ascending branch of ileocolic artery, ascending branch of the ileocolic artery, it is also supplying the ascending colon. Okay, so it is not only right colic artery beta, it is also along with the right colic artery we have the ascending branch of ileocolic artery. Okay, ascending branch of ileocolic artery, ascending branch of ileocolic artery. So obviously बात है, ascending branch will also give this arcuate branches. So yeah, arcuate branches throughout the colon it is present. Throughout the colon it is present. So yes, that is you have to remember. So I always ask my students to trace the path beta. If I ask you ascending branch of the ileocolic artery, it is a branch of ileocolic artery. Ileocolic artery, it is a branch of superior mesenteric artery. Superior mesenteric artery is a branch of abdominal aorta, ventral branch. Ventral मतलब आगे की तरफ. Okay, that is yeah, it is supplying the organ. So yeah, it is the ventral branch of the abdominal aorta. ठीक है, again abdominal aorta, it is continuation of thoracic aorta, arch of aorta, then we have the left ventricle. Always try to reach the left ventricle beta, because the examiner can ask you. Yes, मेरा ये शॉर्ट फॉर्म्स क्या लिखे मुझे नहीं समझ. ascending branch of these two, right? Yes, right colic artery and ascending branch of yeah, ileocolic artery. हाँ, ये दो हैं बेटा. ठीक है, right colic artery, RCS क्या है? ठीक है, right colic artery and the ascending branch of the ileocolic artery. So yes, I hope this particular point is clear to everyone. So in the ascending colon beta, just give me a thumbs up if the site is clear. It is the right lumbar region. Okay, the size, the tinea coli, the peritoneum beta, it is covered from front and sides only, and the blood supply, So I hope these points are clear. I hope these points are clear. Garima, very good beta. Dimple, very good beta. Perfect. चलिए चलिए. So I hope the ascending colon is clear. So yes, now coming on to the relations of the ascending colon beta. Coming on to the relations of the ascending colon, that is like you have to pay a little bit attention over here. Yes, coming on to the relations of ascending colon. Coming on to the relations, Dr. AAA Jayashree, very good beta. So coming on to the relations of the ascending colon, remember beta, the relations you can see, they are like it has anterior relations, something which is present in front. Okay, then we have yeah, medial relations, something which is present medially. Okay, and we have posterior relations, something which is present behind the ascending colon. We have the posterior relations. Okay, so we have anterior relations, medial relations, and we have posterior relations. Posterior relations. So remember beta, anteriorly, the ascending colon, ये जो ascending colon है beta, which you can see over here, which I am highlighting over here, this ascending colon, it is attached to the anterior abdominal wall. Okay, आगे की तरफ क्या प्रेजेंट है बेटा, एंटीरियर एब्डोमिनल वॉल है, जिसकी हमने लेयर्स डिस्कस की थी, स्किन, सुपरफिशियल फेशिया, डीप फेशिया, एक्सटर्नल ऑब्लिक मसल, इंटरनल ऑब्लिक, ट्रांसवर्स एब्डोमिनस, ओके, ट्रांसवर्सालिस फेशिया, एक्स्ट्रा पेरिटोनियल फैटी टिश्यू। तो ये जो लेयर्स है एंटीरियर एब्डोमिनल वॉल, इट इज लाइक ascending colon is directly connected to this anterior abdominal wall. Okay, it is directly connected to the anterior abdominal wall. Okay, it is directly connected to the anterior abdominal wall. You will find greater omentum also, anterior abdominal wall. Apart from that, beta, you will also see anteriorly, yeah, also see there are coils of ileum. You know the small intestine has three parts, duodenum, jejunum, and ileum. So yeah, at some portions you will see coils of ileum also that are covering anteriorly the ascending colon. Okay, okay, medially also beta you will see the coils of ileum. देखो for example ये हमारा ascending colon है. This is the ascending colon. So yes, if this is the ascending colon, AC लिख रहा हूं मैं, ascending colon. So in front of the ascending colon you will see coils of jejunum, and medially also you will see the coils of ileum. Sorry, the coils of ileum. So ascending colon का देखो medial ये हो जाएगा, है ना? So obviously you know the medially you will find the coils of ileum. Okay, and anteriorly also, after that beta, if we talk about the posterior relations beta, posterior, now coming on to above to downwards, now taking a direction beta over here, that is above to downwards, what all structures can you see? Now everyone knows that this particular ascending colon is on which side beta, right side पर है, right side पर है. So starting with the kidney beta, starting with the kidney, remember the lower part of, yeah, this is the lower part of the right kidney. Okay, सबसे ऊपर से और नीचे की तरफ स्टार्ट करते हैं, starting from above going downwards. Remember the first thing that you will encounter beta over here, it is the lower part, it is the lower part of right kidney, or specifically अगर हम पूछा जाए तो it is the lateral part beta. Okay, lower part of right kidney and it is the lateral part. So yes, remember that. After that beta you can see the origin of transverse abdominis muscle. Okay, just lateral and down to it, it is the transverse abdominis muscle. Transverse abdominis muscle. Okay, so you will have over here transverse abdominis muscle just behind, posterior relations are just behind, transverse abdominis muscle. Then we have, yeah, we have quadratus lumborum muscle. If you can just see QL, it is quadratus lumborum muscle. Okay, so we have, yeah, quadratus lumborum muscle, quadratus lumborum muscle. Okay, now we have two nerves beta over here, two nerves which are passing the above nerve. Okay, okay, over here we have the, yes, iliohypogastric and ilioinguinal nerve. These are all the contents which you can see in the quadratus lumborum muscle. So you can see these two yellow colored structures. These are nothing but the nerves, and these nerves are associated with the quadratus lumborum muscle. So remember beta, we have the iliohypogastric as well as ilioinguinal nerve. ilioinguinal nerve. Okay, ilioinguinal nerve. Ilioinguinal nerve. Iliohypogastric and ilioinguinal nerve. Yes. Remember, beta, we will also see, yeah, we will also see the iliac crest. Okay. Iliac crest मैंने बताया था ना, हिप बोन के 3 parts होते हैं. Hip bone consist of 3 parts. Okay. Okay, can anyone tell me the name of the 3 parts, beta? इलियम, ischium and pubis. तो इलियम जो पार्ट है, ILIUM, उसका जो अपर मोस्ट बॉर्डर होता है, द सुपीरियर बॉर्डर, इट बिकम्स वेरी वेरी थिक. दैट इज समथिंग व्हिच इज कॉल्ड एज क्रेस्ट. क्रेस्ट का मतलब होता है बेटा थिकन द बॉर्डर, थिक बॉर्डर. बॉर्डर और ज्यादा थिक हो जाए तो उसको हम लोग क्या बोलते हैं, क्रेस्ट. एंड सिंस इट इज ऑन विच बोन, इलियाक बोन, सो नाम क्या हो जाएगा, इलियाक क्रेस्ट. इलियाक क्रेस्ट, right? So yes, we can see the iliac crest. Obviously, to the iliac crest, we have the iliacus muscle. Iliacus muscle, okay, and iliacus muscle. You can, so it's, yeah, you can see the crest over here. This is the iliacus muscle. Okay, this is the iliacus muscle, and in the iliacus muscle, just anterior to it, what you will find, we have one nerve which is supplying the thigh, and it is called as the lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. So yes, one more component, that is the lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. So I hope this is clear to each one of you. Yes, yes. I hope this is clear to each one of you. जल्दी से एक थम्स अप दे दो फटाफट से. यस, जल्दी से एक थम्स अप दे दो फटाफट से. हाँ, श्वास मेजर भी है. चलो फटाफट से एक थम्स अप दे दो. चलो, आई एम वेटिंग फॉर योर थम्स अप गाइस, एवरीवन. Just give me a thumbs up in the chat box so that I can continue. I hope you are like very well aware. Yes. हाँ, चलो जल्दी से बता दो फटाफट. ओके, चलो चलो चलो. I hope it is clear, beta. The sites, tinea coli, peritoneum, blood supply. Okay, so I hope it is very much clear to each and everyone. The ascending colon. Now coming on to the transverse colon. Garima, very good, beta. Very good, Garima. Garima, very good, beta. So yes, now coming on to the next part, that is the transverse colon. Transverse colon, beta, transverse colon ये इस तरीके से प्रेजेंट होगा. द ट्रांसवर्स कोलॉन. सो ये राइट साइड है, और just a minute, let me like, so you are very well aware that this is the right side according to the normal anatomical position, and this is the left side. Now can anyone tell me from where to where it will be present? Can anyone tell me from where to where it will be present? What will be the site and the location, beta? Yeah, so if we come to the site part, beta, the site part, remember that the transverse colon, okay, it is present in, or I can simply say it extends transversely. Okay, it extends transversely between right and left colic flexures. Okay, it extends transversely between right and the left colic flexure. Yes, Dimple D, very good, beta. Yes, Dr. Triple A, very good. It is the hepatic flexure to the splenic flexure. Right colic flexure क्या है बेटा? It is the hepatic flexure. Okay, और left colonic flexure क्या है? It is the splenic flexure of colon. You already know, I have already shown the diagram. We have the right colic flexure and we have the left colic flexure. So it is like going like this, from right to left, from right to left. Yes, everyone is right. Everyone is right. So remember, it extends from, yeah, the right and transversely between the right and the left colic flexures. Okay, and remember, beta, it is yeah, it is being concave downwards, concave, okay, being, sorry, convex, just a moment, yeah, let me just correct it. It is convex downwards, reaching the umbilicus, okay, it is convex downwards, okay, reaching the umbilicus, reaching umbilicus. So you can very well see in the picture as well, beta. You can very well see in the picture as well. You can very well see in the picture as well that you can see this is, yeah, over here. If you can just put that this is convex, okay, this is convex. So this area, beta, it is coming down to the umbilical region also. It is coming down to the umbilical region also, right? So remember, beta, if we specifically talk about the beginning part, if we specifically talk about the beginning part, so remember it begins at the right hypochondrium. Okay, it begins at like right hypochondrium. It begins in the right hypochondrium region. Okay, and it is following the right flexure of colon, following the right flexure of colon. Whereas we specifically, if we talk about the end part, the end part, so remember, beta, it is the left hypochondrium. Yeah, left hypochondrium. Okay, by becoming left colic flexure, left colic flexure of colon, by becoming left colic flexure of colon. Now, if we talk about the size, beta, the size, remember the size, it is 18 to 20 inches long, right? The size, it is 18 to 20 inches long, okay? The tinea coli, beta, the tinea coli, the folds, basically they are two anterior and one posterior, and one posterior, two anterior and one posterior. Now, if we talk about the peritoneum, peritoneum, so remember, beta, it is completely covered with peritoneum. It is completely covered with peritoneum. It is completely covered with peritoneum. Okay, except, beta, the right 2 inches. Okay, except right 2 inches where it is attached to second part of duodenum. Okay, where it is attached to the second part of duodenum and head of pancreas, head of pancreas. Okay, so here it has a transverse mesocolon, here it has a transverse mesocolon. So I hope these basic points are clear. Yes, I hope these basic points are clear to each and everyone, beta. Yeah, I hope these basic points are clear to each and everyone. Just give me a thumbs up, beta. I hope this is clear to each and everyone, beta. Yes. चलिए, Dr. Triple A Dimple D, very good, beta. Now coming on to the relations, Madhur Sharma, very good, beta. Now coming on to the relations. Now coming on to the relations, beta. Now coming on to the relations of transverse colon. Coming on to the relations of transverse colon. So now, beta, remember we have three relations, beta: anterior, posterior, and inferior. Anterior, posterior, and inferior. So yes. Now, if we come on to the anterior relations, beta, anterior relations, and you guys will tell me कि जहां से transverse colon शुरू हो रहा है, okay, it is starting from the right side, it is starting from the right side. So I want everyone to answer कि right side पर आगे की तरफ क्या देखने को मिलेगा. What you will find over here, the which like I'm highlighting over here, or I'll just use this particular highlighter, the green. यहाँ पे क्या देखने को मिलेगा? Transverse colon is beginning from here. So what you will get anteriorly over here? क्या present होगा यहाँ पे आगे की तरफ? It is covered with which organ, beta? It is covered with which gland, I would say? Lungs, बेटा नीचे कहाँ आ गए lungs? मुझे लग रहा है हाँ, ग्रेटर ओमेंटम होगा। यस, लिवर है बेटा, लिवर है, लिवर है, लिवर है। वेरी गुड डॉक्टर ट्रिपल ए, तुम लोगों ने आंसर दे दिए सारे, बिल्कुल करेक्ट आंसर से बेटा। यू कैन सी द लिवर बेटा, ओके, यू कैन सी द लिवर पार्ट। यस, वी हैव दिस राइट लोब ऑफ द लिवर, right lobe of liver, okay, we have the right lobe of the liver, okay, and okay, if I just have to combine, yeah, I can simply write it as antero superior relations, okay. I'll just, yeah, I'll use black pen because it will be like more good in the pictures. So yes, coming on to the antero, yeah, antero superior relations. So it will be like more convenient to say when I use the term antero superior relations. So yes, it will be the right lobe of the liver. Yes, everyone is right, it is the right lobe of the liver, okay, right lobe of the liver. Plus you can see the gallbladder beta, gallbladder, okay, it is the gallbladder, राइट। इन्होंने क्या किया है बेटा, दे हैव जस्ट ट्राइड टू पुल अप, ओके, उन्होंने ऊपर उठाकर दिखाया आपको, ओके, वरना ये कवरिंग है पूरी, उसके ऊपर प्रेजेंट है, ओके। सो रिमेंबर, या यस, यू कैन सी, या यू कैन सी बेटा दिस कर्वेचर ऑफ द स्टमक। फटाफट से बताओ चैट बॉक्स के अंदर ये कौन सा कर्वेचर है बेटा? विच कर्वेचर इज दिस विच आई एम हाईलाइटिंग? Which curvature is this which I am highlighting, and what is present below this curvature? So these are also present anteriorly. Can you see this? Yes, yes, greater curvature. So remember beta, it is the greater curvature of the stomach, it is the greater curvature of the stomach, and below the greater curvature, yes, everyone is right, Garima, Dr. Triple A, Dimple D, very good beta. And below the greater curvature, what is actually covering this transverse colon? Can you see this transverse colon? It is getting covered, it is getting covered. तो बताइए नीचे की तरफ क्या प्रेजेंट है? व्हाट इज प्रेजेंट लाइक बिलो द ग्रेटर कर्वेचर? व्हिच ओमेंटम इज दिस? व्हिच ओमेंटम इज दिस बेटा? फटाफट से बताओ, जल्दी से बताओ, व्हिच ओमेंटम इज दिस? यस, वेरी गुड गरिमा, इट इज द ग्रेटर ओमेंटम बेटा, इट इज द ग्रेटर ओमेंटम। लेसर ओमेंटम आगे की तरफ है, तो इट इज द ग्रेटर ओमेंटम। अगर ध्यान से देखोगे बेटा, ये पूरा का पूरा आपका ट्रांसवर्स कोलोन है, और लिवर वाला जो पार्ट है वो ऊपर उठा के दिखाया, तो राइट लोब और गॉल ब्लैडर बिल्कुल इसके ऊपर आएंगे राइट साइड पे। फिर वी हैव दिस ग्रेटर कर्वेचर अलोंग विद द ग्रेटर मोमेंटम व्हिच इज कवरिंग द ट्रांसवर्स कोलॉन एंटीरियरली एंड सुपीरियरली। सो एंटीरो सुपीरियर ऊपर की तरफ और आगे की तरफ, राइट। आई होप दिस पर्टिकुलर पार्ट इज क्लियर। जल्दी से एक थम्स अप दे दो इफ दिस इज क्लियर, द एंटीरो सुपीरियर रिलेशंस आर क्लियर टू ईच एंड एवरीवन। यस, जयश्री, वेरी गुड बेटा, वेरी गुड बेटा, इट इज द ग्रेटर मोमेंटम। चलो, डिम्पल, गरिमा, वेरी गुड बेटा, वेरी गुड। तो इफ यू टॉक अबाउट द पोस्टीरियर रिलेशंस, अच्छा, एंटीरो सुपीरियर रिलेशंस बेटा कहां से कहां गए थे हम? राइट से लेफ्ट की तरफ गए थे, राइट। हमेशा यही रूल फॉलो करो बेटा पोस्टीरियर रिलेशंस में भी। इवन डॉक्टर ट्रिपल ए हैज रिटन राइट ए टू, या राइट टू लेफ्ट रिलेशंस है। जयश्री, वेरी गुड बेटा। सो रिमेंबर बेटा, इफ यू टॉक अबाउट द पोस्टीरियर रिलेशंस, posterior relations beta, you are very well aware. Now we will go from right to left, again from right to left, okay. So you can very well see beta, अब इसमें हम लोगों ने क्या किया है, ये जो ड्यूडेनम वाला पार्ट है ना, ये जो ड्यूडेनम, सॉरी ड्यूडेनम कह रहा हूं, ये जो ट्रांसवर्स कोलॉन वाला जो पार्ट है, आई हैव कट दिस पार्ट, ओके, बीच में से इस पार्ट को निकाल दिया है। वी हैव कट दिस ट्रांसवर्स कोलॉन, जो पूरा का पूरा प्रेजेंट होना चाहिए था। यू कैन सी दिस, I hope you all can see this। जो मैं हाईलाइट कर रहा हूं यहाँ पे पूरा का पूरा क्या प्रेजेंट है? ट्रांसवर्स कोलॉन। So I have removed this transverse colon and will be now able to see the posterior relations. Will be now able to see the posterior relations of these transverse colon. So remember beta, over here you can easily see which part of the duodenum, second part of duodenum, second part of duodenum. देखो first part तो ऊपर ये हो गया, first part तो नहीं आता, but second part it is like behind this transverse colon, behind this transverse colon. तो सबसे पहली चीज जो आपको देखने को मिलेगी, it is the second part of duodenum. It is the second part of duodenum, right? Now over here you will also encounter the head of the pancreas. Okay, we have the head of the pancreas. Okay, we have the head of the pancreas over here. If you can just see the arrow, yes, it is the head of the pancreas. So yes, obviously बात है, pancreas is lying in the arms of the duodenum. Okay, pancreas is lying in the arms of the duodenum. उसको romance of duodenum भी बोलते हैं ना. तो obviously बात है, second part of duodenum है, तो उसकी बाहों में क्या है, head of the duodenum. So sorry, head of the pancreas. So remember we have the head of the pancreas also in the posterior relations, right? Now we have a flexure over here beta. This flexure, it is called as duodenojejunal flexure. This flexure, it is called as the duodenojejunal flexure. Duodenojejunal flexure. So this is all behind. Going from right to left, we have the duodenojejunal flexure. Okay, duodenojejunal flexure. Yes. Yes, beta, it is much more behind beta, I would say. Exactly behind नहीं होते और उससे ज्यादा पीछे होंगे डॉक्टर ट्रिपल ए. ठीक है, वो वैसे बनाया हुआ है उन लोगों ने. या हाँ, even you will see the coils of jejunum. You will also see the coils of jejunum beta. Coils of jejunum also, right? So we have coils of jejunum. And remember, yeah, deep बोल सकते हो relations. And inferiorly beta, inferiorly also you will get coils of jejunum. Inferiorly also you will encounter coils of jejunum. Ascending colon beta, ascending colon में क्या था, coils of ileum था. अब ट्रांसवर्स कोलन ऊपर की तरफ आ गए तो इलियम से ऊपर क्या होता है, जेजनम. इलियम से ऊपर क्या है, जेजनम आ गया. ठीक है, सो आई होप दिस इज क्लियर टू ईच वन ऑफ यू. ट्रांसवर्स कोलन, साइट, बिगनिंग, एंड, साइज, टीनिया कोलाई, पेरिटोनियम, and the relations of the transverse colon. And the relations of the transverse colon, again I have to discuss one important point over here, that is the blood supply. That is the blood supply. So I will mention this point over here. Yes. Dr. Triple A, very good beta. Very good. So remember beta, if we talk about the blood supply, I don't even have to tell you, it is the middle colic artery. Okay, we have the middle colic artery and ascending branch of, yeah, upper left colic artery. Upper left colic artery. Okay. Now I have a question to everyone, as I have already discussed the blood supply. Left colic artery, it is a branch of, left colic artery, it is a branch of which artery बेटा, फटाफट से आंसर बता दो तो ये थोड़ा सा क्लियर हो जाएगा. फॉर एग्जांपल इफ दिस इज द ट्रांसवर्स कोलॉन, this is the transverse colon. Yes, yes, so you already know. I will be drawing the diagram beta, so absolutely no need to worry. At the end I will be drawing the diagram. तो या लेफ्ट कोलिक आर्टरी फटाफट से बताओ किसकी ब्रांच है, सुपीरियर मेसेंट्रिक की है, इंफीरियर मेसेंट्रिक की, यही बता दो. So you already know we have the superior mesenteric artery. Yes, the superior mesenteric artery. Yes, and yeah, it is giving off the middle colic artery, and this middle colic artery, it is dividing into the right branch and the left branch. Okay, the middle colic artery, it is dividing into the right branch and the left branch. SMA की है लेफ्ट कोलिक आर्टरी, नहीं. and these are again giving beta these arcuate branches, and you already know. So this is the middle colic artery, and yeah, this is SMA, superior mesenteric artery ka branch hai middle colic artery. So it is coming like this. It is giving off these arcuate branches, so that each part of the transverse colon is supplied, right? So yes, लेफ्ट कोलिक आर्टरी, अब मैं बिल्कुल ही गुस्सा हो जाऊंगा क्योंकि मैं बता चुका हूं तुम लोगों को। लेफ्ट कोलिक आर्टरी तो बेटा इंफीरियर मेसेंट्रिक आर्टरी की ब्रांच होगी ना। वी हैव द इंफीरियर मेसेंट्रिक आर्टरी बेटा, और उसी में से निकलती है लेफ्ट कोलिक आर्टरी विच इज सप्लाइंग द डिसेंडिंग कोलॉन। ओके, सो लेफ्ट कोलिक आर्टरी इट इज डिवाइडिंग इनटू अपर ब्रांच, ascending branch and descending branch, ascending branch and descending branch। बेटा राइट और फिर वही गलत आंसर्स नहीं। हाँ, मिडिल कोलिक आर्टरी, ठीक है, मिडिल कोलिक आर्टरी नहीं पूछा था मैंने, मैंने तुमसे लेफ्ट कोलिक आर्टरी पूछा था ना, लेफ्ट कोलिक आर्टरी पूछा था मैंने। तो बेटा इंफीरियर मेसेंट्रिक आर्टरी है, जैसे सुपीरियर मेसेंट्रिक आर्टरी इज अ वेंट्रल ब्रांच ऑफ द एब्डोमिनल आयोटा, उसी तरीके से इंफीरियर मेसेंट्रिक आर्टरी भी है। So it will give rise to the left colic artery. It will divide into ascending branch or descending branch. So ascending branch, it is also supplying to this transverse colon. Ascending branch, it is also supplying to this transverse colon, right? So I hope this arterial supply is also clear to each one of you, beta. Just give me a thumbs up if this is clear. Already, I will draw the diagram again for your understanding today, right at the end. So yeah, transverse colon is done as of now. Transverse colon is done as of now. Yes, perfect. Now coming on to the right colic flexure and the left colic flexure. Right colic, it is also called as the splenic flexure of colon, and left colic, sorry, right colic, it is called as the hepatic flexure of colon, and left colic, it is called as the splenic flexure of colon. Yes, 2 by 3rd or 1 by 3rd. Yes, that concept is there. I will be coming to that concept also. Already I did this in blood supply of gut. So yeah. So remember, beta, we have the right colic flexure and we have the left colic flexure. Right colic flexure, it is also called as the hepatic flexure of colon. Hepatic flexure of colon, and left colic flexure, it is also called as splenic flexure of colon. Splenic flexure of colon. Yeah. Now, remember, beta, if we talk about the position, now we will be differentiating it on the basis of position, shape, attachment to diaphragm, yeah, arterial supply, and at last the relations. So position, shape, attachment to diaphragm, arterial supply and relations. So remember the position of the right colic flexure, beta, it is the right flexure of, okay, or sorry, right hypochondrium. Okay, it is the right hypochondrium. It is the right hypochondrium. Okay, below the right lobe of the liver. It is the right hypochondrium below the right lobe of the liver. Okay, the left colic flexure, it is the left hypochondrium. Okay, in contact with lateral end of spleen, and even the tail of the pancreas, okay, Now remember the shape beta, it is a blunt flexure. Okay, blunt knife होता है ना, so it is a blunt flexure जिसमें धार नहीं होती, a blunt flexure, and it is forming right angle. Right angle मतलब कहने का मतलब है 90 डिग्री का एंगल बनाता है. And remember it is a sharp flexure. Okay, it is a sharp flexure forming acute angle beta. It is forming acute angle. It is forming acute angle. So yes, we have the blunt flexure forming the right angle and the sharp flexure forming the acute angle. Attachment to the diaphragm, the right part, it is not attached to the diaphragm. It is not attached to diaphragm. It is not attached to the diaphragm. And remember the left colic flexure beta, it is attached to the diaphragm by a ligament. Can anyone tell me the ligament? What is the name of the ligament through which the the left colic flexure is attached to the diaphragm? What is the name of the ligament? That has been a question in exams multiple number of times. So remember beta, it is attached to the diaphragm. And remember that too with the help of a ligament via phrenico-colic ligament. Phrenico-colic ligament beta. Phrenico-colic ligament, and that is the ligament of the diaphragm. It is the phrenico-colic ligament. Right? If we talk about the arterial supply beta, the right colic flexure, it is supplied by the right colic artery, and the left colic flexure, it is supplied by the left colic artery. Yes, phrenico-colic ligament, Dr. Triple A, very right. Right, beta, right. Relations. Now, relations you already know. If we talk about antero-superiorly, आगे की तरफ और ऊपर की तरफ, you already know we have the colic impression. It is also called as the colic impression, where you will encounter the right lobe of the liver. Okay, posteriorly, I don't even have to tell you, posteriorly and inferiorly, you will encounter the right kidney, the lower part of the right kidney. Okay, the lateral lower part of the right kidney. And medially beta, it is the second part of the duodenum. Medially, it is the second part of duodenum. You already know antero superiorly ऊपर की तरफ हो जाएगा. So yes, you can see the right lobe of the liver. Okay, और पीछे की तरफ बेटा देखोगे, so you will encounter the right kidney. और medially, बिल्कुल medially देखोगे तो it is the second part of the duodenum. Okay, so if you just want to remember, you can just remember by the help of this picture also. So you already know that this is the right colic flexure. So posteriorly we will have the kidneys. Okay, we will have the kidneys. Okay, inferiorly भी किडनी होगा और पीछे की तरफ भी इसके क्या होगा, किडनी होगा. ठीक है, this is the right kidney. Okay, this is the right kidney. And yeah, medially you already know we have this second part of the duodenum. Okay, medial side तो यही हो जाएगी. Medially you will encounter the second part of the duodenum. So yes, it is the second part of the duodenum that you will encounter medially, right? So now coming on to the relations of the left colic flexure beta, left colic flexure. So yes, remember that antero superiorly. अच्छा फटाफट से बता दो रिलेशंस, तो ये वाला तो तुम्हें क्लियर होगा. एंटीरो सुपीरियरली क्या प्रेजेंट होगा लेफ्ट कोलिक फ्लेक्शन में? एंटीरो सुपीरियरली व्हाट विल बी प्रेजेंट बेटा? फटाफट से बताओ, जल्दी से बताओ चैट बॉक्स में. एंटीरो सुपीरियरली व्हाट विल बी प्रेजेंट? हम्म बताओ बेटा, आगे की तरफ क्या प्रेजेंट होगा? उसको हम स्प्लेनिक क्यों बोलते हैं? स्प्लेनिक फ्लेक्चर ऑफ कोलॉन क्यों बोला जाता है उसको? Why we say it as the splenic flexure of colon? ऑब्वियस सी बात है, आगे की तरफ और ऊपर क्या प्रेजेंट है? स्प्लीन प्रेजेंट है एंड टेल ऑफ पेनक्रियास, स्प्लीन एंड द टेल ऑफ पेनक्रियास। डिम्पल कृति गरिमा, वेरी गुड डॉक्टर ट्रिपल ए, ये तो बहुत इजी चीज थी। पोस्टीरो इंफीरियरली बताओ, चलो कंपेयर करो, पोस्टीरो इंफीरियरली क्या प्रेजेंट होगा? जल्दी से कंपेयर करो। या पोस्टीरो इंफीरियरली व्हाट इट विल बी प्रेजेंट? पोस्टीरो inferiorly we have the, yeah, left kidney along with diaphragm, left kidney and diaphragm, and laterally beta, lateral side पे remember we have the left kidney. Okay, left kidney, yes, very good, very good, very good. सबका ठीक है, कृति, डॉक्टर ट्रिपल ए, जयश्री, वेरी गुड बेटा, वेरी गुड। तो राइट कोलिक फ्लेक्चर एंड द लेफ्ट कोलिक फ्लेक्चर, आई होप द डिफरेंसेस आर क्लियर. The blood supply, attachment to diaphragm, shape, position and relations. In one slide I have like given you the entire information, so just give me a thumbs up that it is clear to each and every one of you, so that I can start with the next part. Yes, just give me a thumbs up in the chat box if it is clear to each one of you, so that I can start with the next part. Yeah, Garima, Dimple, very good, beta. Very good. So, yes, coming on to the descending colon, coming on to the descending colon, the first thing that you have to keep in mind, beta, what is the site? Okay, what is the site or the location? Okay, what is the site or the location, beta? Yes, everyone is right. Kriti, Dr. Triple A, Jayashree, very good. Descending colon. Okay, so remember, beta, it is present in the left lumbar region, left lumbar, but it starts from the left lumbar region, beta, but majority of it lies in the iliac region. Okay, the iliac region and the left iliac region. Okay, the left iliac region. Okay, the left iliac region. Okay, so remember, beta, it, yeah, it descends. Okay, or you can simply say it descends from the left colic flexure. ऊपर क्या प्रेजेंट है? लेफ्ट colic flexure. Okay, it descends from the left colic flexure above to the left border of pelvic brim. Okay, where it ends by becoming the sigmoid colon, where it ends by becoming the sigmoid colon. So remember, it descends from the left colic flexure above to the left border of pelvic brim, where it ends by becoming the sigmoid colon. Remember the size, beta. Remember the size over here. The size, it is approximately 10 to 12 inches long. Okay. It is exactly the double of the length of the ascending colon. But remember, what is the difference between the ascending and the descending colon? The descending colon, it is having a narrow lumen. Okay, as compared to ascending colon, the lumen of the descending colon is narrow. The lumen of the descending colon is narrow. Coming on to the next point, that is the tinea coli. Coming on to the next point, that is the tinea coli. So remember, it is one anterior and two posterior. Okay, one anterior and two posterior, just like the ascending colon, beta. Okay, if we talk about the peritoneum, it covers the front and sides. It covers the front and sides. Okay. Now coming on to the relations. Coming on to the relations. And if we talk about the interior relations, beta, anterior relations. Remember, anterior relations and lateral I will combine together. So they are attached to the anterior abdominal wall, just like the ascending colon. Okay, anterior abdominal wall. Anterior abdominal wall. Okay. Yeah, we can see beta greater omentum also, right? Coils of small intestine you can see. Yeah, these are like much not shown in the picture. These are the coils of small intestine. We have greater omentum also. Okay, so that is something which is present anterior आगे की तरफ or lateral side पर present है. That is present laterally also. Now, if we talk about the medial relations, the medial आपको पता ही है, अगर ये ट्रांसवर्स कोलॉन है तो मीडियली क्या प्रेजेंट होगा? मीडियल ये हो गया ना, मीडियल, तो मीडियली क्या प्रेजेंट होगा? इंटेस्टाइन. मीडियली व्हाट विल बी प्रेजेंट? इंटेस्टाइन ओनली. So remember, medially we have coils of small intestine. We have coils of small intestine. We have coils of small intestine. Now coming on to the posterior relations beta. Coming on to the posterior relations, and again beta it remains the same as we discussed in the ascending part. Posterior relations. Okay, posterior relations. Now beta, which kidney will be over here? Which kidney will be over here? Firstly beta, you can see the diaphragm. The first structure, it is the diaphragm. Okay, tell me which kidney will be over here. Chalo answer do fatafat se. Which kidney will be over here? Lower part of. Yes, everyone is right. Kriti, Dimple, Dr. Triple A, Garima. Very good. It is the lower part of the left kidney. It is the lower part of the left kidney. Now coming on to the third part, beta. Yes. Coming on to the third part. Yes. Coming on to the third part. Yeah. We have the transverse abdominis muscle. Again, it will remain like everything same, transverse abdominis muscle. Yes, everyone is right. It is the transverse abdominis muscle. Then you already know we have quadratus lumborum muscle. Okay. So yes, left quadratus lumborum muscle. Transverse abdominis तो transversely present है सब जगह है, तो उसमें right left नहीं हो सकता, but quadratus lumborum right होगा और left होगा. So over here we will have the left quadratus lumborum muscle. Okay, left quadratus lumborum muscle. Okay, so again this muscle will contain which two nerves? You already know we have the ilio hypogastric nerve. Okay, and the ilioinguinal nerve. I have already discussed in the muscles also beta. जब इस muscles को supply करने वाली ये nerves है. So yes, I have already discussed in the posterior abdominal wall muscles. So we have the ilioinguinal nerve. We have the ilioinguinal nerve. Okay, so yeah. Now the fifth one, we have the left iliacus muscle. Okay, we have the left iliacus muscle. Okay, the left iliacus muscle will contain the left cutaneous nerve of thigh, left cutaneous nerve of thigh, and also we will have the femoral nerve. Also we will have the femoral nerve. So yes, also we will have the femoral nerve over here. Yes. So what other things we can see? Yes, we have the left psoas major muscle. Psoas major muscle. Okay. Psoas major muscle, and yeah, the structures which are in front of it. Peter, you can see this artery over here. You can see this artery over here. It is the left gonadal vessel. Okay, this artery, it is the left gonadal vessel. Gonadal vessel beta कहने का मतलब है testicular artery in males and ovarian artery in females. So in front of the left psoas major muscle, we have the left gonadal arteries. Okay, we have the left gonadal arteries, and we have the left gonadal vein. Okay, left gonadal vein. So left gonadal arteries and left gonadal vein. Okay. Now we also have a nerve which is supplying the genital region. It is the left genitofemoral nerve. Left genitofemoral nerve. Okay, the left genitofemoral nerve. Okay, and we have the left external iliac artery. We have the left external iliac artery. So that were about the posterior relations that you have to remember. Okay, the anterior and medial are like very easy. Descending colon done, right colic flexure, left colic flexure done. Relations of the transverse colon, ascending colon, parts of the large intestine done. Now coming on to the pelvic or sigmoid colon. Now coming on to the pelvic or sigmoid colon. I hope everything is like crystal clear to each and everyone. Just give me a thumbs up, guys, if it is clear to each and everyone. Yes. So if you can see the sigmoid colon beta, it is in the pelvic cavity and it is in the iliac fossa. Yes, dimple, Dr. Triple A Garima, very good. Very good, beta. So remember, beta, the pelvic or sigmoid colon, it is in the iliac fossa. Okay, it is in the iliac fossa in pelvic cavity. Iliac fossa in the pelvic cavity. Shape, you have to remember, it is S shaped. It is S shaped. Size, you have to remember, it is 16 centimeters long. Okay, 16 centimeters long. Now it begins, sorry, 16 inches long. 16 inches long. Remember, it begins as continuation of descending colon. It begins as continuation of descending colon. Okay, begins as a continuation of descending colon. Okay, in front of the external iliac artery. Okay, and yeah, it ends opposite to, yeah, it ends opposite to the third sacral piece, the third part of the sacral vertebrae. Yeah, the third sacral piece by becoming rectum. By becoming rectum. So it ends opposite to the third sacral piece by becoming rectum. Okay. So yes, yes. So remember, beta, it relations. If we talk about the relation status, like very easy to remember over here in this case. Superiorly, beta, what will be present? Yeah, superiorly, it will be, yeah, superiorly and to the right. What we will get? Coils of ileum. Coils of ileum, right? Posteriorly, we have the sacrum. Posteriorly, we have the sacrum. We have the left ureter and the left internal iliac vessels. Left internal iliac vessels, right? And on the left side, if you see, you will get the left wall of the pelvis. Okay, left wall of the pelvis, and we will have left external iliac vessels. External iliac vessels. Okay, and you will also get ovary in females and vas deferens in males. Yes. तो या पोस्टीरियरली पीछे क्या है? सेक्रम है, ठीक है। पीछे क्या पास हो रही है? लेफ्ट यूरेटर और लेफ्ट इंटरनल इलियाक वेसल्स. Now when I say internal iliac vessels, I'm talking about the internal iliac arteries and veins. अब इसके लेफ्ट साइड पे देखो, ओके सॉरी, अब इसके लेफ्ट साइड पे देखो, यू विल एनकाउंटर द लेफ्ट वॉल ऑफ द पेल्विस, द लेफ्ट एक्सटर्नल इलियाक वेसल्स. ऑब्वियसली बात है, लेफ्ट साइड पे जाओगे और ओके, ये राइट साइड है, और लेफ्ट साइड पे और जाओगे, इसके साइड में आपको क्या दिखेगा? यू विल हैव द लेफ्ट एक्सटर्नल इलियाक आर्टरी, लेफ्ट एक्सटर्नल इलियाक वेन, ओवरीज दिखेंगी और वास्ट डिफरेंस दिखेगा मेल्स में, राइट? Now, coming, I hope this is clear to each one of you. Beta, just give me a thumbs up in the chat box if it is clear to each one of you. Just give me a thumbs up in the chat box if it is clear to each one of you. If it is like clear to each one of you, just give me a thumbs up in the chat box. Yeah. Kriti, very good, beta. Very good. Very good. Now coming on to the arterial supply of the colon, beta. So I will explain this with the help of a diagram. I will explain this, Dr. Tripoli, very good. I will explain this with the help of a diagram. Already I have like explained this. So yeah, it will just be a revision for you people. It will just be a revision for you people. Chalo, Jayashree, very good beta. Jayashree, very good beta. Chalo. Now you already know we have the superior mesenteric artery. Yeah, we have the superior mesenteric artery which is coming like, okay, it is passing in front of the third part of the duodenum and passing behind this transverse colon. You already know this is the transverse colon, right? This is the transverse colon. This is the ascending colon. This is the descending colon. This is the sigmoid colon rectum. Then we have the cecum. Yes. And then we have the appendix. Then we have the appendix. Appendix, right? Now, you already know that, yeah, we have this superior mesenteric artery. Okay. So I'm just like drawing it like this. So the superior mesenteric artery, it is coming from behind the transverse colon. It is coming behind the transverse colon. You already know superior mesenteric artery. It is originating from the abdominal aorta. It is the ventral branch of the abdominal aorta, guys, right? So बार-बार बताने की जरूरत नहीं है. It is the superior mesenteric artery. It is the superior mesenteric artery. So it runs behind the transverse colon, okay? And yeah, it runs behind the transverse colon. So yes, this is the artery and it is going like in oblique fashion. Yes, it is going like in oblique fashion, beta. It is going like oblique fashion, okay? And to the right side. So yes, beta, it has three major branches that you have to remember as of now. You already know, I have already told you about, it has the right colic artery. Okay, it has the right colic artery. We have the, yeah, we have the middle colic artery, the middle colic artery, and yes, we have the ileocolic artery. We have the ileocolic artery. Okay, the ileocolic artery. So let us just try to name these branches of the superior mesenteric artery. Let us just try to name these branches. So yes, you already know this is the right colic artery. I'm writing A for artery. We have the middle colic artery and we have the left, sorry, left click wrong. Yeah, it is the ileocolic artery. It is the ileocolic artery. So these are direct branches from the superior mesenteric artery. Again, I have told you beta, the right colic artery, the right colic artery will divide into, okay, will divide into the upper branch and the lower branch, right? The right colic artery will divide into ascending branch and descending branch. So it is the ascending branch and the descending branch. The ileocolic artery, it will also, yeah, it will be having an ascending branch, yes, and it will be having, yeah, the descending branch, which will anastomose with the superior mesenteric artery only. Okay, so if I ask you, superior mesenteric artery is anastomosing with which branch, Pita? Can anyone tell me in the chat box? It is anastomosing with which branch, Pita? It is anastomosing with the lower or the descending branch of the ileocolic artery. So you can see now the lower branch of the ileocolic artery, it is self anastomosing with its own like superior mesenteric artery over here. So remember beta, तो अगर मुझे नाम देना हो, okay, if I have to give name, so remember it is the, yes, it is the lower branch or descending branch, okay, of ileocolic artery. I see A लिख रहा हूँ, ileocolic artery. This is upper branch. This is again lower branch of right colic artery, upper branch of right colic artery. Okay, so yes, this is the point of anastomosis that you will get over here. Now, this is the point of anastomosis. So remember, beta, this is, yeah, this is, yes, this is the point of anastomosis. So the lower branch anastomose. So this lower branch of ileocolic artery, it anastomose with its own superior mesenteric artery terminal part. Okay, it anastomoses with its own superior mesenteric artery terminal part. So yes, now yes, वो सही लिखा था बेटा, arcuate branches भी हैं तो वो हम बना लेते हैं इस तरीके से. So you can see they are giving straight branches. Okay, these are giving straight branches so that each part is supplied. So yes, now if I ask you the ascending colon beta, the ascending colon, अब देखो right colic artery तो supply कर ही रहा है, right colic artery upper branch, right colic artery lower branch, ascending colon को supply कर रहे हैं. Even the upper branch of ileocolic artery, it is also supplying the ascending colon. अब ये point समझ में आ गया सबको? अब ये वाला point समझ में आया? फटाफट से thumbs up तो if it is clear to each and everyone. Yes. Chalo, I hope this point is clear to each and everyone. Beta, remember the lower branch will also give supply to the cecum. It will also give supply to the cecum. Yes, Kriti, very good. Yes, Dimple, very good. It will also give supply to the cecum. Yes, Jayashri, very good. Yes, and this is something which is called as the cecal branches, anterior and posterior cecal branches of the ileocolic artery. Okay, of the ileocolic artery. Ileocolic artery beta, yes, ileocolic artery lower branch, it will also supply the appendix. It will also supply the appendix, and this is something which is called as, the appendicular artery. Appendicular artery, or remember beta, appendicular artery is an end artery. End का मतलब होता है it is not anastomosing with anyone. End का मतलब होता है it is not anastomosing with anyone. End means it does not anastomose with anyone, right? Now beta, I hope this is clear to each one of you. And middle colic artery, beta, middle colic artery will also give, yeah, it will also give right and left branches. एक right side में जाएगा and one will go towards the left side, and it will give arcuate branches. Now this is something which is referred to as the arcuate branches, right? Arcuate branches. Yes, arcuate branches. So yes, the middle colic artery will also give these arcuate branches, which you can see over here, which you can easily see over here, right? Then beta, then coming on to the inferior mesenteric artery. Okay, if suppose this is the, yes, this is the inferior mesenteric artery. So I'm writing this as inferior mesenteric artery. Inferior mesenteric artery. And remember that, can anyone tell me how many branches are there in the inferior mesenteric artery? Yes, we have three branches, beta. Yes, we have the left colic artery, we have the left colic artery, we have the sigmoidal artery, and we have the superior rectal artery. We have the sigmoidal artery, we have the superior rectal artery, and we have the left colic artery, which again divides into the upper branch and the lower branch. The upper branch and the lower branch, again giving off arcuate branches. So see, transverse colon, the left portion, it is supplied by the left colic artery. It is supplied by the left colic artery upper branch, right? The left colic artery upper branch. So remember beta, we have this colic artery left colic artery. Yes, we have the left colic artery. Yes, Kriti, very good, beta. We have the sigmoidal artery. So this is the sigmoidal artery, which is supplying the sigmoidal colon. And we have the rectal artery. We have the rectal artery. So left colic artery, it is a branch of inferior mesenteric artery. Inferior mesenteric, abdominal aorta, ventral branch. Continuation of thoracic aorta, arch of aorta, left ventricle. So every time try to reach the left ventricle. Okay. So this is how the arterial supply looks like. This is how the arterial supply looks like. Okay. So if you can see beta over here, if you can see over here that in together, these all branches which are supplying the colon. Okay. These all branches which is supplying the colon, which I have just highlighted, these all branches which are supplying the colon, this is called as the marginal artery of Drummond. Okay, this is called as the marginal artery of Drummond. Okay, this is the marginal artery of Drummond. Okay, marginal artery of Drummond. Bit of what my purpose to say over here is, in majority of the population, okay, in majority of the population, this right colic artery, okay, followed by middle colic artery is absent. Okay, it is the common absent artery of the gut. Okay, so if it is not there, then what will happen beta? If right colic artery is not here, obviously the upper and lower branches will be not there. Middle colic artery is not here, then obviously right and left branches will not here. So in that case, what happens? The ileocolic artery beta, the ileocolic artery will extend its upper branch to the transverse colon. Okay, and middle colic artery, okay, if right colic artery is not present, that could be one of the case. So what will happen? Ileocolic will extend its upper branch and middle colic will extend its right branch downwards, so that the blood supply is never hampered in these cases. Okay, the blood supply is not compromised over here, right? Now one, it is like Dr. Triple A has only said about the, yeah, Griffith's point. Yeah, Griffith's point, beta, that you have to remember. Griffith's point, it is present at the splenic flexure. Splenic flexure, okay. It is junction between midgut and hindgut. It is junction between midgut and hindgut, right? Now it is vulnerable to ischemia. because the blood supply is over like hampered over here. It is vulnerable to ischemia. Ischemia means blood supply becomes less. Okay, because over here the anastomosis are like absent, so that's why, right? So that is. Now, what happen if this anastomosis are absent? But yeah, there is an arc of rhiolin which is present. Now, when I say arc, okay, I'll just write it over here so that you understand. Arc of rhiolin. Now, arc of rhiolin, it is a direct connection between the left colic artery and the middle colic artery. Okay, it is the direct connection between the middle colic artery and the left colic artery. So, yeah, this is now giving blood supply in these cases, and that is why these areas like being more vulnerable is not vulnerable to ischemia anymore because a direct connection is like developed between the middle colic and the left colic artery, which can again supply this area with proper blood. Okay, so that is something that you have to remember better over here. So now coming, I hope the arterial supply is clear to each one of you. I hope the arterial supply is clear to each one of you. Just give me a thumbs up, beta. I hope the arterial supply is clear to each one of you. Sure. बता दो फटाफट से. चलो जयश्री वेरी गुड बेटा. जयश्री वेरी गुड. Venous drainage, remember beta, it is the superior and inferior mesenteric veins. Superior and inferior mesenteric vein. Superior mesenteric vein, and you already know the splenic vein when combined together to form the portal vein, and inferior mesenteric vein drains into splenic vein. Splenic vein, and this superior and splenic vein will together form the portal vein, okay, which will again divide into the right and the left branches. Yes, that is like you already know. The lymphatic drainage, beta, you have to remember we have, yeah, epiploic lymph nodes, or yeah, sorry, it is the epicolic lymph nodes. Epicolic lymph nodes. Okay, we have the paracolic lymph nodes. Paracolic lymph nodes, intermediate lymph nodes, intermediate lymph nodes, and we have the terminal lymph nodes. Terminal lymph nodes. So that you just have to remember this. Okay, epicolic lymph nodes, basically epi means upper. They are present on the walls of the colon, beta. Paracolic, basically it is like on the upper, no, sorry, on the along the inner border of the colon they are present, right? Intermediate along the colic artery, okay, and terminal it is along the superior and inferior mesenteric arteries. Along the course of these arteries, these lymph nodes are present, the terminal lymph nodes. Coming on to the nerve supply, beta, coming on to the nerve supply. Remember the sympathetic one, the sympathetic nerve supply, it basically comes from T5 to T12, okay, and parasympathetic, it comes from vagus nerve. It comes from vagus nerve. So that is all about today's lecture. That is all about the today's lecture. I hope you understood the nerve supply of colon, lymphatic drainage, venous drainage, arterial supply of colon, okay, pelvic or sigmoid colon, descending colon, right colic flexure, left colic flexure, relations of transverse colon, and ascending colon and relations, and parts of the large intestine. So I hope it's clear. So yeah, goodbye. Just one or two more lectures, then the abdomen will be entirely completed. I've completed each and every point, Peter. So yes, notes are like very much sufficient if you read them. Okay, goodbye. Goodbye.